What is diffuse versus intestinal gastric adenocarcinoma? Imagine two different ways stomach cancer can grow and behave. They are called diffuse and intestinal types, and understanding these differences helps doctors decide on the best approach for each patient. Both are forms of gastric adenocarcinoma, which is the most common type of stomach cancer. But they develop in very different ways and have different features. The intestinal type of stomach cancer usually forms well-defined, gland-like structures that look similar to the lining of the intestines. These tumors often appear as larger, bulky masses that can grow outward or develop ulcers in the stomach lining. They tend to grow along a broad front, forming polyp-like or mushroom-shaped tumors. This type is often linked to environmental factors like infection with Helicobacter pylori bacteria and certain dietary habits. It generally develops gradually, starting from chronic gastritis, then progressing to intestinal metaplasia, and finally turning into cancer. Intestinal type is more common in older adults and often occurs sporadically, meaning it appears without a clear family history. On a molecular level, these cancers show chromosomal instability and changes in receptor proteins that help cells communicate. Patients with intestinal type often have a better outlook compared to those with diffuse type. In contrast, the diffuse type of stomach cancer is characterized by poorly cohesive tumor cells that spread throughout the stomach wall without forming a clear mass. Instead of a lump, the cancer infiltrates the tissue, causing the stomach to become thickened and stiff. This process can lead to a condition called linitis plastica, sometimes called the leather bottle stomach, because of how rigid and contracted the stomach becomes. The key molecular feature here is the loss of a protein called E-cadherin, which normally helps cells stick together. When E-cadherin is lost, the cancer cells break apart and spread as single cells, invading deeply into the stomach wall. This type tends to affect younger patients and can run in families. It is often more aggressive and has a worse prognosis than the intestinal type. Because the cancer cells are scattered and do not form a solid mass, it can be harder for doctors to detect and diagnose early. To sum up, the main differences are how the cancer grows and spreads. The intestinal type forms cohesive, gland-like tumors that are easier to see and often develop step by step. The diffuse type spreads as scattered cells that infiltrate the stomach wall, making it more difficult to detect early and often leading to a poorer outlook. The molecular changes also differ, with intestinal cancers showing chromosomal instability and diffuse cancers involving the loss of E-cadherin. Recognizing these differences is important for diagnosis, treatment, and understanding the prognosis of stomach cancer. Always remember, if you or someone you know is concerned about stomach health, consulting a healthcare professional is essential for personalized advice and care.